My name's Dave Clemmett. I'm the Assistant Director for Operations, which is in the Salford City Council. I think one of the key bits of learning from today that I've got is that I was thinking about the role of Care Navigator and thinking that the advice that we give to people who we meet and come through our doors is really necessary for us to understand the whole of the system and the different parts that health and social care plays in that. So for instance, do we all know something about the Carers Centre, what it offers? Do we all know what Burrows House and Equipment Services can offer? Because again, we're only as good as the pathways that we're aware of for individuals and how they can properly, I suppose, navigate systems and how we can help them do that, because there isn't somebody else who's going to do this care navigation. It's down to us all to be able to do that in a proper way.
Well, actually what I've learned today is there's a lot of really good stuff going on, but it's all been happening in isolation, and now there's a great opportunity for us all to work together and share some of that learning and actually develop new PDSAs and new ways of working.
I'm Richard Warner, I'm the Clinical Director for Acute Medicine at Salford Royal. The thing that struck me today is the very, very simple tests of change, such as checking postural blood pressure in the community, but understanding that those little tests that are free to do have the biggest impacts.
I'm Jenny Walton, I'm a GP at the Lakes Medical Practice in Swinton. We've been involved in one of the neighbourhood pilots, and I think what's impressed me today is the amount of practical hints and tips and what other MDGs have been doing, so that we can then adopt those and also be in a position whereby we can coordinate what's going on and involve all the elements of the partnership in the pilot project and the integrated care programme, so that we're actually doing things for patients.
Well, what I've got better than last time, for the simple reason it was in everyday lingo. And I think that I can pass that on to all, not just Barton ladies, all the community of Eccles and Salford or wherever.
I think the key learning we've taken so far is the importance of working both across agencies and across teams, the importance of taking not only national evidence but actually applying that locally, getting local teams to adapt and adopt that to meet their local circumstances, and applying some of the best practice that's established both internationally and within Salford. Highlight from this morning has clearly been the level of commitment and enthusiasm. We've had almost 100 people here today, and everyone in this room is really committed to making a difference to Sally Ford and her family.